Have you ever laughed a little too hard, coughed suddenly, or simply stood up from a chair and felt an unexpected, embarrassing leak? You're not alone. In fact, after the age of 60, nearly 1 in 3 adults experiences some form of urinary incontinence, and yet almost no one talks about it. It can feel shameful, confusing, and even frightening. But here's the truth most people never hear. This isn't just about getting older. Sudden urine leaks can be a sign of deeper issues, and in many cases, they're entirely fixable. Stay with me, because the most important tip that can help you regain control might just be the last one. Now, you might be thinking, isn't this just part of aging? That's what we've all been told. But the bladder doesn't suddenly give up at 60. Something triggers the change. It could be a shift in muscle strength, nerve communication, hormones, or even daily habits you never knew were harming you. And here's the good news. Once you identify what's really going on, you can often turn it around. It's not about pads or pills. It's about understanding your body and giving it the support it's quietly asking for. Let me ask you, how old are you right now? Write your age in the comments. I read every single one. And tell me this, have you ever had to plan your day around bathroom access or skipped going out because you were afraid of an accident? You're not alone. But it's time we talk about what's really happening inside your body. First, we have to talk about pelvic floor muscles. They're like a sling supporting your bladder, uterus, and rectum. And just like any other muscle, they weaken if you don't use them. Years of sitting, weight gain, or childbirth can slowly erode their strength. When those muscles get weak, they can't hold back urine when you sneeze, laugh, or even just walk. One simple thing you can start today is to perform gentle pelvic floor exercises, often called Kegels. If you're not sure how to do them, imagine stopping the flow of urine midstream. That's the muscle you want to strengthen. Do 5 gentle squeezes, holding each for 3 seconds. Repeat this 3 times a day. It's subtle but powerful, and with regular practice, many people notice improvement in just a few weeks. But muscle weakness isn't the only culprit. Let's talk about nerve signals. Over time, the communication between your bladder and your brain can get a little scrambled. This means your brain might get the message, "Go now," even when your bladder isn't full. The result? You rush to the bathroom or leak before you get there. Diabetes, stroke, Parkinson's, and even spinal arthritis can affect these nerves. If you suspect this is happening, ask your doctor about bladder training. It's a technique where you slowly extend the time between bathroom visits, training your bladder to hold more and reducing those urgent signals. It takes patience, but many people find real success in just a month or 2. Next up is something that surprises many people: constipation. Yes, really. A backed-up bowel presses against your bladder, reducing its capacity and irritating the nerves that help control it. If you're not going regularly, at least once every day or 2, it's time to look at your fiber intake. Add more leafy greens, oats, chia seeds, and water. Warm lemon water in the morning can stimulate the bowels naturally. One patient of mine was waking up 3 times a night to urinate. After resolving her chronic constipation, that dropped to once. It's all connected. Caffeine might be your morning ritual, but it could be your bladder's worst enemy. Caffeine is a known bladder irritant. It stimulates muscle contractions and increases urine production. That morning coffee or strong black tea? It could be sending your bladder into overdrive. If you're drinking more than 2 cups a day, try gradually switching to decaf or herbal alternatives. Many people see a dramatic drop in sudden urges within days of cutting back. Alcohol is another sneaky culprit. It relaxes the muscles in your pelvic region, including the ones you need to hold urine. It also acts as a diuretic, increasing urine production and reducing your ability to sense fullness. A glass of wine at night might seem harmless, but if you're waking up multiple times or leaking, try cutting it out for a week. The difference might surprise you. Let's not forget about hormones. For women, menopause causes a sharp decline in estrogen, which weakens the tissues around the bladder and urethra. This makes leaks more likely. For men, an enlarged prostate, called benign prostatic hyperplasia, can block urine flow or cause dribbling. If you're experiencing hesitancy, a weak stream, or incomplete emptying, it's worth getting checked. Simple medications or lifestyle changes can make a big difference. Medications can also play a role, especially diuretics, antidepressants, and blood pressure drugs. These can either increase urine output or interfere with nerve control. Never stop a medication on your own, but do ask your doctor if your prescriptions might be contributing to the problem. There are often alternatives. Hydration is a tricky balance. Drink too little and your urine becomes concentrated and irritating. Drink too much and your bladder gets overwhelmed. Aim for 6 to 8 cups of fluid a day, mostly water. And here's a trick. Stop drinking fluids about 2 hours before bed. That simple habit alone can help reduce nighttime leaks. Now here's something few people realize. Your walking pattern or gait can affect your pelvic health. When your posture changes or your core weakens, it places pressure on your pelvic floor. Try this. Stand up tall, engage your abdominal muscles slightly, and walk with intention. This gentle alignment helps support your pelvic organs. Combine that with light core strengthening exercises like seated marches or gentle bridges, and you can reduce pressure on your bladder throughout the day. Finally, stress. Emotional tension triggers the release of cortisol and adrenaline, two hormones that make the bladder more reactive. Ever noticed you need to pee more when you're anxious? It's real. Chronic stress can lead to overactive bladder symptoms. Daily deep breathing, stretching, or even light yoga can help reset that nervous system. Try breathing in for 4 counts, holding for 4, and exhaling for 6. Do that 3 times when you feel tense, and watch your bladder calm down too. Let me tell you a quick story about Mary, age 67. She was vibrant, active, and full of life, but she started avoiding her weekly bridge club. Why? Because she was terrified of laughing too hard and leaking. She tried wearing pads, drinking less water, even skipping meals. But the turning point came when she learned to strengthen her pelvic floor, reduce caffeine, and focus on gentle core exercises. Within a few months, the accident stopped. She got her confidence and her life back. That's the power of understanding your body instead of hiding from it. So, let's recap. Sudden leaks after 60 are common, yes, but they are not inevitable. Weak pelvic muscles, nerve miscommunication, constipation, irritants like caffeine and alcohol, hormone shifts, certain medications, poor posture, and chronic stress all play a role. But here's the hope. Each one of these factors can be improved. You don't need to suffer in silence or accept it as your new normal. Your body can heal. It just needs the right kind of support. Even small, consistent changes can make a dramatic difference over time. And you're not alone. Millions of people face this challenge, but most never get the guidance they need. I want you to know, there's nothing shameful about what you're experiencing. It's not your fault, but it is within your power to change it. If you found this video helpful, please take a second to like it, subscribe, and turn on notifications so you never miss important health updates. And most importantly, share this video with a friend, sister, or parent who might be struggling with the same issue. You could change someone's life just by passing this along. Now tell me in the comments, what surprised you most in this video? Was it the connection to stress, the impact of constipation, or maybe the role of posture? I'd love to hear your thoughts and experiences, and if there's a topic you'd like us to cover next, just say the word. You deserve to feel strong, confident, and in control at every age.